Thank you, Chairman Smith, Ranking Member Neal. I want to thank our witnesses here today to address healthcare affordability. You are the top CEOs in the country when it comes to healthcare. The fact is this: back home in Iowa, premiums are too high. Families and businesses are struggling to manage these rising costs. What families, seniors, and veterans want from this hearing is solutions on how we can cut premiums, how to cut premium costs, and ensure that they still have quality, affordable health care. That's it. That's what we want to do. And this is my top priority for Iowa, to have quality, affordable health care. It's our responsibility to get this done. The costs are so high that people are now choosing not to purchase insurance, or they're lowering their amount of coverage they can receive, creating high deductibles. This causes people to choose not to go to the doctor for routine care or use the hospital as their primary provider when their health turns extremely bad. Since Obamacare became law, small businesses and health insurance premiums have skyrocketed, right? Affordable health care is not affordable. It's outpacing dramatically wage growth. So I applaud President Trump for putting forward a plan to change the status quo. Congress needs to work alongside him, and we need all of us to work together for affordable health care. So here's my question. When I'm back in Iowa, I hear from families and small businesses who tell me they feel trapped in a system that they believe is tilted against them. Rising premiums force them to take losses, pass their costs on to their employees, or they have to raise prices for their insurance for their employees. So how do we make healthcare more affordable? Mr. Hemsley, can you explain, under Obamacare, were there any incentives that existed to reduce costs, or was it just more to manage costs?
Thank you for the question, and I think your instincts around managing cost and incentives to manage cost are completely right. The Affordable Care Act was largely around coverage and coverage dynamics, and addressed many of the coverage issues in the marketplace, but it was not as focused on cost. And so that's why I applaud the leadership that's being bipartisan leadership that is focused on the input costs of healthcare.
Yeah. And so you've talked about lowering costs, you've talked about different things here, but here's my question. In rural Iowa, all right, rural Iowa, we have a captive audience. Now, I believe in capitalism. I absolutely believe in capitalism. I am worried that if we don't start, you guys each have a monopoly, in essence, in your territories. I mean, in Iowa, we have pretty much one carrier, UnitedHealth here, there a little bit. But when I see that, where we're going, where we're trekking down, if it wasn't for Trump and others, we'd probably have government-run health care. I mean, that's what the Democrats want. This is scary stuff. And I say that, Mr. Joyner, how can we change that dynamic and create more competition within the marketplace, especially in rural America? And Mr. Hemsley, I'm going to ask you that same question, if you can think about it.
Yeah, so Congressman, it's a great question. It's consistent with what we've talked about, for the most part today, which is creating an environment in which you allow the plans to compete. And I think there are three things that we're trying to solve for, which is the health status of the population continues to worsen. So we need to focus on the prevention, focus on things that actually help people stay out of the hospital. And so when they get to the hospital, making sure that the plans have the effective tools to negotiate effectively with the providers. And then lastly is the drug manufacturers, which today are still 25% of the cost, growing significantly, making sure that we have the tools to actually allow for competition to lower the cost of brand pharmaceuticals in this country.
Yep, thank you. And Mr. Hemsley, you got 30 seconds?
Again, the theme about pursuing value-based care, which is in many respects why some of the businesses and areas that we're in is because you can coordinate it more effectively. You can bring all these other resources together and integrate and break the fragmentation that exists in the healthcare system and change the incentives to pay physicians to promote wellness and oversight in terms of keeping populations in good health, in the right settings, not using the more expensive resources, and keeping you in that way, you can contain this trend and make healthcare more affordable, and you'll see great competition.
Thank you so much. I look forward to working with you because we got a job to do, and that is reduce the cost of premiums. Thank you so much. I yield back.
Mr. Bean. Thank you very much, Mr. Chairman. A very good evening, Ways and Means Committee, and to our panelists. Welcome. We're glad to have you here. America is grateful for